Now you have been taking dapagliflozin for some time. Suddenly you remember, oh God, I have missed one dose. Don't panic. It's okay. It's humanly possible that if you are taking, especially if you are taking a lot of medication, a lot of drugs, it's humanly possible that you might forget one day. But the chances, as I said, are less because you have to take it just once a day. Even if you forget it, remember the moment you remember, take it immediately. But remember that it should not be close to your next dose, right? The next day's dose, because if you take these the missed dose with the next scheduled dose, which is close by, then you are taking double the dose that was prescribed for you. So then that can lead to lowering of the blood sugar to a more drastic level. It can go much lower down, and you could feel giddy. You could feel light. There could be feeling of lightheadedness, and you could feel you could be unconscious, etc. All the symptoms of low blood sugar could come up. So therefore, it's best to either keep a calendar, a diary, or put a reminder in a mobile phone or somewhere so that you don't forget to take the tablet, and see to it that you take the tablet at the same time every day. Now, if you can forget to take one dose, there is also a chance that you could take an extra dose. Okay, humanly possible. You might forget. So in the moment you realize that you have taken double the dose, again, don't panic. Immediately contact your physician or doctor, or if it's not possible, then go to your nearest hospital or a health center or a doctor so that they can take adequate measures. Now, we have talked about the effects and what to do, how it is taken, etc. But we have seen that generally people talk more about whenever side effects, whenever your physician prescribes a medication, first question that we ask is, how is it safe to use? Are there any side effects? Right? A drug is a chemical substance, so every drug is bound to give you side effects, right? But unless and until you don't follow your doctor's instructions, or if you follow your doctor's instructions carefully, properly, you take the dose, take the medication at the right dose, at the right time, at the right frequency as per your doctor's instructions, then the chances of getting side effects are very, very minimal. But nevertheless, dapagliflozin, like other drugs, is also associated with some side effects. So we will try to tell you, note down some side effects that are seen, which could occur. Now, since it's a drug to treat diabetes, it can cause fall in the blood sugar levels. It has been shown to lead to urinary tract infections, okay, in males as well as in females. So as you know, the signs are that you will get high fever, there is burning when you pass urine, pain while passing urine, etc. So you know that these are the signs of urinary tract infections. Please inform your physician immediately. There could be fungal infections of the private parts of both males and females, okay, of the vagina or of the penis. So has to be very careful. Please observe. It's not that it happens in everybody, but it could happen with some patients. But nothing to worry. And one important thing to remember is that all drug-induced side effects slowly disappear as you get used to the drug, or if they're too severe, the doctor will stop you from taking or stop the medicines, and then you'll find that the reaction disappears completely. You could have either a running or a stuffy nose. You could have nausea, vomiting, which is there with any tablet. There is one important side effect that the physician also knows, and that is called as ketoacidosis. Now, these are ketones. This means that this disease, ketoacidosis, means that there is excess amount of a substance called as ketones in your blood and urine. So the urine smells very typical of, it has a very typical peculiar smell of ketones. So then this is a condition which needs immediate treatment, increase in dose or whatever, the doctor will take adequate care. So if you find uh, any change in the smell of your urine, please inform your physician. You could have some confusion, loss of appetite, there could be some low backache, there could be headache, dizziness, your skin could become cold and pale, or you could have slightly blurred vision. Right? Please inform your physicians accordingly. The uncommon or rare side effects that could happen are cough, dry mouth, fainting or lightheadedness, tightness in the chest. You could have sweating or increase in the heart rate, foul smelling discharge from, especially in the penis. So men have to be careful to see if there is some foul smelling discharge from their penis, there is a rash on the penis, or there is redness, itching, or swelling of the penis, then you have to be aware and you have to be vigilant and try and inform your physician immediately. So if it is severe, they will take adequate care of it and decide whether to continue dapagliflozin or to switch over to some other medication.